Another question we've received: is VeriFide ideal for health plans with smaller provider networks?
Yeah, VeriFide's actually great for plans of all sizes, but what we find with plans with smaller networks is that they have limited resources, and often provider onboarding and enrollment is even more critical to their process and their network. They work very hard to recruit these providers, get them into the organization, and the last thing they want to do is be losing providers to prolonged enrollment timelines. And all of that process starts with the credentialing.
What are some of the reasons why health plans with smaller provider networks may shy away from using outsourced PSV servicers?
The quick answer is control, right? So a lot of organizations, especially the small ones where the staff are much closer to the task, taking on multiple responsibilities within the credentialing workflow, they just don't want to give up that control of the process. They don't want to trust another entity to pick up the job that they've been doing for a long time. I think sometimes that staff is concerned about minimizing their value to the process or to the organization by outsourcing some of those tasks. And oftentimes the real value in credentialing is coming from that critical credentialist, that credentialing analyst's eye, and being able to understand what belongs in the network and what doesn't belong in the network and how to efficiently manage that process. So not focusing time on the time-consuming, administrative, task-oriented type activities, and really focusing on what they're good at, which is really looking at critical information and making determinations as to what providers deserve the right to be in front of their members. A good example is a small organization that I recently worked with. They are working towards their NCQA accreditation, and this credentialing staff of one person didn't have the bandwidth to really deal with the accreditation requirements, building out the credentialing committee, as well as managing the application collection and the verification of the files once that information was in the house. So we worked closely together to really help identify kind of her processes, where we can help out from a CAQH VeriFide perspective, and kind of roll that into her workflow so that she could focus on what matters. And I think to her, one of the things that was probably the biggest qualifier for VeriFide and working with CAQH was really the quality. So outsourcing that activity to another organization, if you're going to have to go back and redo that work because they're not doing good work, kind of defeats the purpose of having somebody else do your job for you. So at CAQH, when we developed the CVO, our focus was primarily around the quality of our outputs. We didn't want to be just another CVO pushing work out, but not really pushing out quality work. So we actually hold ourselves to a standard of less than a 2% error rate on all of our credentialing files. And when we've been independently audited by 3 of our largest clients, they've actually identified that we have less than a 1% error rate. So that trust really allows the client to just take the information and run with it and focus on the more meaningful tasks than just checking boxes through a verification method. And so being part of that process with clients, both large and small, is very satisfying, being able to understand their process, because every organization is different, and finding ways for us to add value and kind of relieve some of the administrative burden that those organizations have and letting them focus on really what matters. It's what working at CAQH is all about.